Hi everyone, my name is Julia Mayetta. We are so pleased that you could join us for this week's lecture in Volume 3 of our 12-week No Neuropsychology Didactic series that brings you lectures from experts in the field covering different topics each week. This series was created by trainees and early career neuropsychologists to provide free, high-quality didactic opportunities. And we would like to thank our sponsors for their financial support of the series. Before we start, here are the disclaimers for the series. So this training is not meant to replace formal education in neuropsychology, and the views of the speakers are their own. Questions can be submitted via the Q&A box on the lower left corner of your screen, and we will record today's lecture to put on our website later this week. Now it is my pleasure to introduce Dr. Miguel Arce Renteria for today's lecture on deconstructing bilingualism and its sociocultural determinants for research on cognitive aging. Dr. Arce Renteria is an associate research scientist and neuropsychologist at the Taub Institute for Research on Alzheimer's Disease and the Aging Brain in the Department of Neurology. He's originally from Tijuana, Baja California, Mexico, and he moved to the United States to pursue a degree in psychology, receiving his BA in psychology from San Diego State University in 2008. He received his PhD in 2017 from the clinical psychology program at Fordham University, specializing in neuropsychology, and he joined the Manbrick Labs in 2017 as a postdoctoral fellow under the mentorship of Dr. Jennifer Manley. He was recently awarded an NIA-funded K99R grant this last year, and his research investigates the sociocultural and environmental determinants of disparities in cognitive aging and Alzheimer's disease and related dementias. His current focus has been on determining factors of reserve and resilience to Alzheimer's disease and related dementias among racial and ethnic minorities, such as understanding the role of bilingualism and literacy. So without further ado, I will turn it over to Miguel.
Awesome. All right, so let me get my screen. Okay, great. Thank you for the introduction, and thank you, obviously, to everybody involved, the organizers of neuropsychology, for inviting me. This is very exciting, and just also generally, I'm a fan of everything you guys are doing. This is a wonderful seminar that you guys are doing, and so it's very cool to be a part of this. And so, all right, so let's begin. Title, you saw the title before. Just quickly, I'd just like to share some disclosures. Obviously, given that the focus is on bilingualism and its potential benefits to cognitive aging or not, I do want to say one of my biggest disclosures is that I am bilingual myself, right? Like Julia mentioned, I'm from Tijuana, Mexico, hablo español. So obviously, I'm personally invested to find a positive association here, but obviously I remain very scientifically unbiased and sound methods for the work that we do. Also just providing some of the funding sources. I'm funded through the NIA and the Alzheimer's Association to do this work. And I also, just a quick plug, mentioned that I am also the co-chair for the Bilingualism, Literacy, and Language Special Interest Group, which is part of the Diversity and Disparities Professional Interest Area of the Alzheimer's Association, of the ISTART group. So we meet once a month. And in order to participate, you'd have to be a member of ISTART, and I highly recommend that we have active meetings every month with people from all over the world discussing issues of bilingualism and literacy language as it relates to cognitive aging and Alzheimer's disease. All right, so to begin, obviously this is the main reason why we're all here today, for this talk, right? That there's plenty of great research that has suggested that bilinguals may be able to retain similar levels of cognitive functioning in the face of age and or AD-related, Alzheimer's disease-related neurodegeneration compared to monolinguals. Here I'm just highlighting just a few of these wonderful studies that have supported this. However, there is a lot of other studies that say that maybe not. Maybe we're also here because we're interested in this, that there's been several strong studies that do not find support for bilingualism as a protective factor. I think what's important to start to address how can we compare these two different studies, body of work, let's talk a little bit about some of the methodological differences. Because for these studies, they do not find a benefit on either rate of cognitive decline or on risk of incident dementia, whereas the previous studies do find that bilinguals compared to monolinguals tend to develop Alzheimer's disease, dementia later in life compared to monolinguals. So first thing that I'd like to address are the methodological differences in study design between these two big camps of research. First, those studies that do not find a benefit are all, that do find a benefit, excuse me, are all retrospective, meaning that their data is being, retrospectively looking into the past in terms of determining age of diagnosis, the age of symptoms. It's also clinic-based, and largely cross-sectional. While the studies that do not find the support are largely prospective, community-based, and longitudinal. So some of the challenges of retrospective studies are that they are susceptible to selection bias, meaning that to the use of selection bias due to the use of patients at a memory clinic, right? Because we have to think about how representative are the participants that are being seen, that are going to the clinic? Are they representative of the community as a whole? And then using patient, family member, or caregiver recall of time of first symptoms can lead to potential recall bias in caregivers reporting date of a patient's first dementia symptoms. That's why, just to set the stage, an ideal approach to investigate a causal link should be, it's either having a prospective cohort study of community-dwelling bilingual individuals who are free of dementia at baseline, who use a baseline assessment of bilingualism status, and ideally assessing bilingualism over time. As we'll discuss, there's a lot of different factors of bilingualism that can change over time. Frequent waves of data collection, a long follow-up period, and obviously the determination of dementia diagnosis by a team of experts, including neurologists and neuropsychologists. And lastly, the use of culturally and linguistically appropriate cognitive evaluations, especially when we're working with bilinguals, right? Are we assessing them in the appropriate language? And if so, are we using the appropriate instruments for that? So this, this would be the ideal setup in terms of assessing a true causal link. And so these are really the big differences between these two camps of studies, that those who are, prospective, community-based, longitudinal, don't really find any benefit. Those who are retrospective, clinic-based do. But beyond these study design issues, there are several methodological differences that may explain these inconsistent findings. So first of all, what is bilingualism? Like, how is it defined? You'd be very surprised how inconsistent the definition of bilingualism has been. With some studies, you could use a simple yes or no, actually based on a self-report, or others do a more strict definition, such as at a certain level of proficiency in both languages, then you're considered bilingual. And beyond that, most studies focus on establishing group differences between bilinguals and monolinguals in ADRD risk, and treat bilinguals as a monolithic group, right? And so with that, it makes it unclear to understand which aspects of bilingualism are more likely to protect against AD. Because then bilinguals can differ on various characteristics, including age of second language acquisition, proficiency, frequency of language use, a degree of code switching, that all of these different components may influence cognitive aging. And in addition to that, there is inconsistent control for potential confounders. Bilinguals can differ from monolinguals in critical environmental and sociocultural factors, such as educational experiences, socioeconomic status, both in childhood and adulthood, and immigrant status, for instance, that these factors influence the ability or the opportunity for someone to become bilingual. And as we know, as we'll discuss further later on, these are also factors that are associated with late life brain health, cognitive health. And so with inconsistent control for these potential confounders and the additional lack of consistency in terms of what aspects of bilingualism are we measuring, if any at all, these differences could explain inconsistent results across studies. And so now, given these issues, we need to deconstruct bilingualism into its different components that may be providing reserve or resilience in the context of cognitive aging. And so, as I mentioned before, all of these factors have been associated with either a cognitive or structural outcomes in some cross-sectional studies that are not related to cognitive aging. For instance, individuals with early bilingual age of acquisition tend to not only have higher second language proficiency, but may demonstrate better cognitive control as well. Also, language usage, more so than even that proficiency, has been associated with changes in white matter microstructure in cortical regions related to language control. And other studies show that age of acquisition and language usage can differentially modulate pattern of brain activation during lexical retrieval of two languages, and as well. And then other studies find that there's better performance in individuals on executive functioning measures among those who engage in greater code switching, meaning switching in the same conversation, switching from one language to the next, like you're speaking in English, luego estás hablando español, and then you go back to English, that frequency. So given this prior work, finding that these different components are associated with cognitive or structural outcomes, I think it is critical to move away from just the bilingual, monolingual comparisons to really try to understand how these different aspects of bilingualism can impact cognitive aging. And also what's important about this is would also mimic the literature on risk and protective factors in cognitive aging, which they don't only focus on whether a person knows something or not, right? But rather it's on the behavior, on the degree of engagement in, for example, cognitively enriching activities, or how many years of education, leisure activities, even for things as aerobic exercise. It's not just yes, no, it's understanding more the behavior around it. And so just to highlight, I'm going to do over some studies that exemplify how breaking down bilingualism is useful in understanding its role in cognitive aging. So here I'd like to show some of the work by Dr. Tamar Golan, in which she focused on degree of second language proficiency among cross-sectional clinic-based sample of English-Spanish bilinguals. Here, by using an objective measure of proficiency, she found that greater proficiency was associated with a later age of AD diagnosis. So if you'll see here in the figures, you have on the x-axis the objective assessment of proficiency with greater numbers meaning more proficient, and on the y-axis you have age of diagnosis. What was interesting here is that they found this association among those who had fewer years of education compared to those with higher years of education. So providing even some evidence of the role that different aspects of bilingualism and how it may be moderated by socio-demographic factors such as years of education. Other study, similarly, which is a recent study by Marco Calabria and his group in Spain, they evaluated a cross-sectional clinic-based sample of Spanish-Catalan bilinguals. And here they deconstructed bilingualism largely based on language usage by defining bilingualism on a continuum ranging from passive all the way to active, where active bilingualism would represent individuals with high proficiency in the L2 language and will in both, and balanced usage. So they're using both languages daily and frequently, while passive bilingualism was defined as largely someone who's able to understand an L2, but with little or no usage of it. And here you see that greater active bilingualism, which is represented in the x-axis, was associated with a later age of onset of symptoms and a later age of diagnosis for MCI. So again, at least now these studies really shedding a light to why it might be important to understand these different components of bilingualism as it relates to cognitive aging. Now I'd like to quickly go over some of my own work. So the first study I had the opportunity to work with was with a sample of 106 Spanish-English bilinguals from the UC Davis Aging Diversity Cohort. Here, we dichotomized the bilingual group into 48 active and 58 passive bilinguals, somewhat similar to Calabria's approach from the previous slide. However, here we use groups rather than a continuum spread, where here the active bilinguals self-reported that they use both languages daily, whereas the passive bilinguals reported largely using one language over the other. Here, all participants were Latinx. Majority were Mexican, as we mentioned, based on Northern California. And we wanted to evaluate here using a cognitive reserve model, whether bilingualism moderates the association between medial temporal structures, integrity of these structures on memory functioning. And here all models adjusted for age, sex, gender, years of education, immigration status, and childhood SES, as we had said previously, right, that these are all factors associated with better cognitive outcomes and are in the pathway that provides the opportunity or the ability for one to become bilingual. Here on this first figure on the left, I'm showing that there were no differences in terms of just main effects of bilingualism on cognitive performance. Here we're looking at semantic memory performance, a composite score. We're seeing that there's no differences between the two groups. This second figure, results are a little bit more consistent with what we would expect for a reserve or resilience idea, such that you'll see on the x-axis, we have a cortical thickness with lower scores on the left, and with semantic memory performance from a composite score on the y-axis with higher scores, meaning better performance. As you'll see here, in blue, the passive bilingual group demonstrates the association that you would expect, right? That with lower cortical thickness, we're seeing lower performance. However, we're seeing that active bilinguals at a greater degree of atrophy were able to maintain their performance compared to passive bilinguals. I do want to point out that the relationship seems to flip at the higher end of cortical thickness, which isn't what we would hypothesize, but we need to further explore that, especially longitudinal data will help further evaluate this association. And then now I will briefly go over preliminary results from the offspring study. This is a study led by Drs. Jennifer Manley and Adam Brickman, my co-mentors, that evaluates the offspring of participants from the Washington Heights Inwood Columbia Aging Project, which is a community aging project of adults of 65 and above, Medicare eligible, followed over many years. And so this is of the studies evaluating their children who are currently in midlife. Here, we wanted to evaluate whether active bilingualism moderates the relationship between parental AD status, given that we know from the parents being in the YCAP study, the association between parental AD and cognition. Given that in the overall sample, which we're showing here on the right, there was a negative association between parental AD and cognition, meaning that those who had a history of parental AD in their history were demonstrating worse performance across all these different domains. But for this study in particular, we focus only in the bilingual group. And so 136 active bilinguals with 52 passive bilinguals. Here, almost all participants are Dominican, given that we're based here in New York City. And again, we adjusted for age, sex, years of education, and immigration status, and childhood SES. And so what I'm showing here, what I want you to see here are the estimates and the 95% confidence intervals showing the association of parental AD and active bilingualism on each of these cognitive outcomes. I forgot to mention for this, we also focus specifically on performance on the NIH Toolbox Cognitive Battery, which largely focus on domains associated with executive functioning. So as you can see here, on the left, we have the effect on attention, processing speed, set shifting, and working memory. And as you'll notice, here we're showing the effect of active bilingualism across these domains, that active bilinguals tended to perform better on a measure of processing speed compared to passive bilinguals, but not reliably different in the other domains. And what you'll see here is now we're depicting the association of parental AD on these cognitive outcomes. As you're seeing, there's no reliable association of parental AD with cognition here. Ideally, what we would have liked to have seen is like in the similar figure from before, where most of the scores, the estimate should be below 0, indicating a negative association. But here, we did not find that in this subset of participants that were only bilingual and Latinx. And then lastly here is to depict that moderating effect, right? That the effect of parental AD on cognition would differ by active or passive bilingualism status. So here, just to depict it, we're showing stratified models, figures, where you have the effect of parental AD within the active bilingual group on the left and within the passive bilingual group on the right. And as you'll notice, they're pretty similar, and we're not seeing any reliable difference from a 0 here. Again, this is preliminary data, as the data collection is ongoing. And we'll see whether the associations remain with larger larger samples. Okay. And so hopefully, by this point, I've convinced you that it's worth our time to deconstruct bilingualism in our studies and on whether it provides reserve or resilience in cognitive aging. And so now the key question is, well, how do we operationalize this construction? How do we do it? As we mentioned before, like these are what I'm proposing that I think should be the key ones that at least people should be collecting, right, the age of acquisition, proficiency across different areas, speaking, reading, writing, understanding, language use, current language use across different areas, code switching, degree of frequency across different contexts. Ideally, we would also use both subjective measures and objective measures. For subjective measures, you would wish to assess several domains, as I mentioned here right now. And for self-report, I myself have been using a version of the bilingual language profile, which was developed by Gerton, Amengual, and Birdsong. But there's plenty of other measures as well that are available, such as the language experience and proficiency questionnaire, which is the LEAP-Q, or the language and social background questionnaire, which was developed by John Anderson and Bialystok. And objective measures can vary. Personally, in my work, we are using the multilingual naming test, which was developed by Tamar Golan, where we are able to assess in both in English and Spanish whether a person is, we get a degree of bilingualism index and language dominance. And so that allows us as an objective assessment of proficiency in both languages. And we also have to think about what other objective measures that we can do. In the psycholinguistic literature, they have wonderful other ways to approach it. That could include recording speech, having them read different vignettes in dual language, and get other assessments from that. And then now to switch over to issues related to study design, causal inference, cognitive reserve, and confounding factors, right? Because first we were focused on deconstructing bilingualism. Now we have to go back to the original question, right, of why we were here, right? Can bilingualism protect against age-related cognitive decline and dementia? As I mentioned before, right, all the studies that provided support were cross-sectional, right? And I already described the ideal study design at the beginning of the talk. And then it is also very important to evaluate longitudinal associations between bilingualism and cognitive decline, and how does it predict development of dementia. And more so than just looking at prevalence, than how much people have dementia at a given moment in time, at baseline, for example. And so in order to take a cognitive aging approach to evaluate to whether bilingualism provides reserve or resilience, we must take into account sociocultural and confounding factors. Just a quick thing that I want to take a moment to mention as well is really focusing on how we're using the terms cognitive reserve and resilience and how we're evaluating. So in order to understand how bilingualism can confer reserve, it is crucial to evaluate how these different aspects relate to cognition, ideally in the presence of neuropathology. So many previous studies investigated the protective effects without including structural brain measures of markers of AD neuropathology, or even known risk factors that are associated with our clinical or cognitive outcome. And so it's important to have these three components when evaluating a cognitive reserve. So ideally the status of the brain, which would reflect brain change or pathology, a clinical or cognitive performance outcome, and your measure of reserve, the proxy that would be. In my case, it's these different aspects of bilingualism. And as well, in epidemiological studies, risk factors for dementia are sometimes used in the absence of brain message. For instance, like in the previous slides from my work, we're using parental AD, right? It's a known risk factor. And as we showed before in the overall sample, there's a negative association with cognitive outcomes. And so obviously it's not completely informative of brain processes or pathology, but still these models can test if individuals with higher levels of this reserve proxy, which is bilingualism in my case, can tolerate higher risk factor levels. And then this has been wonderfully described in this white paper by Dr. Stern and et al. And I highly recommend you look at this one if you're planning to evaluate cognitive reserve. And so like as I was mentioning, right, so we were deconstructing bilingualism, and that may lead to some of these differences in these prior studies. And now the issue in terms of confounding factors. And so here, I'd like to provide walk through a somewhat complicated model to walk you through it in terms of how we have to think about our approach as it relates to cognitive aging, right? We're trying to evaluate if it's impacting rate of decline or incident risk. So right, you have to think about it in a life course kind of approach, right? So here, we'll walk through this. So, right, you have aging, you're born, you're aging, then stuff happens to your brain, right? We're thinking, amyloid, tau deposition, cerebrovascular disease, and then it leads to an outcome such as dementia. Here, your outcome could also just be slope of trajectories, cognitive trajectories, like rate of decline over time, right? So that's generally what we're thinking. And at some point in an individual's life, bilingualism happens. And either bilingualism can modify this association, right? That, it'll protect the effects of aging. It'll protect the brain from the effects of just aging, or it can moderate this association, right? The effects of brain pathology, brain injury on your outcomes, right? So one of these associations can be there. But then in addition to that, right, bilingualism does not happen in a vacuum, right? It's not just randomly assigned or anything. So there's a lot of childhood contextual factors that are directly associated with bilingualism, such as the childhood SES of the individual, the premorbid cognitive abilities, the intellectual functioning as a child, the years of education, the quality, of that education, and the social and neighborhood environment status of the child growing up. That it, does it allow for bilingual exposures? Does it restrict those kinds of things? And then somewhere along those lines is what we have migration history, right? Depending on, specifically, for example, here in the United States, we know that most of the individuals who are bilingual tend to be immigrants or from immigrant families. And then we also have adult contextual factors, right? Like adult SES, the overall health of the individual, their healthcare and their access to healthcare. Also, keeping as an example in the United States, that we know if you're not very proficient in English, right? If you're even bilingual, but with low proficiency in English, the access to healthcare will be different, all right? And the quality of the care that you'll have access to will be different. And then obviously the social neighborhood environment as an adult as well. And we know that these factors have a direct association as well with brain health in late life, right? With your dementia risk. And so childhood contextual factors have an association on adult contextual factors, which they themselves have an impact on brain health. Specifically, there's also childhood contextual factors have an association with just brain health as well, besides your dementia risk, and adult contextual factors as well, right? And so it is important to think about all these factors as you're relating them to your models of whether bilinguals have a protective benefit compared to monolinguals to begin with, right? Because then also, from everything we said from the very beginning, we also have to think about, well, what aspects of bilingualism and how are we measuring those, and at what point in an individual's life, right? I'm not saying that this model is, first of all, it's all inclusive, right? I'm sure there's a lot of important areas here that we need to think about. The degree of how these arrows are associated with one another, the thickness will vary depending on the population you're working with. And that's why it's very, very important to understand the social demographic background and the cultural history of the groups. For example, I was mentioning I had to work with bilinguals from Northern California, or primarily Mexican, who their cultural and immigration history is very, very different than the groups that I've been working with in New York, which are primarily Caribbean. And it's important to understand how do those relate to bilingualism and to our outcomes of interest, right? And again, like mentioning, and it'll vary by place that you're working with. From the group that I mentioned that I'm a coach here earlier on, the coach here is Subarna Ladi, a doctor from, a neurologist from India. And she was mentioning, for example, in India, it is pretty common. Bilingualism is somewhat common, more so than how it is maybe in the United States. And so then you may want to understand, well, then why is someone monolingual? What are some of the sociocultural background history that places an individual in the more likelihood of being monolingual versus bilingual? And how does that then relate to the outcomes that you're ultimately wanting to evaluate? And so the point is that it's important to keep all of these elements kind of in mind, and then you can start teasing apart. I'm not saying you have to test all of this all at once, but you can start breaking them into different parts to start adding more to this story. And just for the last few minutes, I'd like to provide an example why this matters, and really why it matters in terms of how are we defining the groups, and understanding these different sociodemographic factors in our study. So here I'll provide a simple table 1 demographics from the offspring study, from what I was mentioning earlier, middle-aged adults This is across all racial and ethnic groups, which includes non-Hispanic white, Black African-American, and as well as Hispanic Latinx participants. And so here, we're just grouping them as either bilingual or monolingual based on whether they know another language or not, right? If we were to just leave it like that, as some studies do, just compare bilingual monolinguals, right? It's important to understand how these groups are now differing from social demographic factors. So for instance, the monolingual group tends to be older. They tend to have fewer years of education. They're primarily Hispanic. As you'll see there, 80% of the monolingual group here is Hispanic Latinx compared to the bilingual group. Their median split of income, they're almost 80% of them are below 35, the median income, which was 35K for this sample. So they have lower SES, primarily Hispanic, a little bit older, lower education. And we're using parents' education as a proxy for childhood socioeconomic status. And so we see that, their parents had lower years of education compared to the bilingual group. So meaning lower childhood SES. And then they were primarily tested in Spanish, the monolingual group. And the majority of the monolingual group were not born in the US, right? So only about 18% of them. So meaning that they're immigrant for the most part. And so for example, now if you're gonna then test whether, all right, if my groups differ on a cognitive outcome, how confident are you to say that it's because that they're bilingual and the other's monolingual, versus how much is it all these other factors that are playing a role that we know influence cognitive aging. And so then let's say we do what we were suggesting earlier, we ignore the bilingual monolingual group, we just focus on bilinguals, dividing them by active and passive, and again, across all the racial ethnic groups. The differences and these social demographic factors now tend to kind of flip a little bit. So passive bilinguals tend to be older. There's no difference in terms of the gender distribution, the years of school completed, but now the active bilingual group is majority Hispanic Latinx compared to the passive group. So the active bilingual are younger, primarily Hispanic, with a lower childhood SES compared to the passive bilingual group. And they were primarily, half of them were tested in Spanish, whereas the passive bilingual group primarily were tested in English. And same thing as before with the immigration, where active bilinguals here are primarily immigrant compared to passive bilinguals. And remember, here is active bilinguals are those who say they use 2 languages daily. And the passive bilingual group is the group that they know a second language, but they don't use it daily. They might use it in a different context. And so again, we're still seeing these important social demographic differences. Oh, and lastly, and with this group, again, it was everybody, right? All the racial ethnic groups together. So here we're not even considering the languages that the people are using, which there's other studies that show that might matter. How different the languages that you're using may be more of a cognitive load, which may provide, for example, more of a benefit rather than if there's 2 languages that are more similar from one another. And so here we have English and Spanish, primarily bilinguals, but we also have English and Italian, English and Russian, and so forth. And so you can even think about that, right? The immigration histories of these different groups may not necessarily be the same. And so then let's say we were to decide, okay, let's just focus on the Latinx group, right? So we try to remove as much as we can of these unmeasured confounds and try to make the sociocultural factors of these groups a little bit more similar, right? Also, it's only English and Spanish now, bilinguals. And still, your passive bilingual tend to be a little bit older among the Latinx. Then now we see a difference in terms of gender distribution, where passive bilinguals are majority female. They have lower years of education. Their income, they're primarily have lower SES. Also with parental childhood SES, although the difference is a lot smaller than we used to see before, but it's still statistically significant. And again, they were primarily tested in Spanish. For the active bilingual group, it's a mix of some were tested in English, some were tested in Spanish. You could even then argue, you could work off of this group, include these appropriate confounds, think about how it's included in your models in terms to evaluate your outcome of choice. And another way to further refine the group perhaps is you could really only focus on the immigrant group, right? If you're focusing on the immigrant Latinx group, you're really even more now trying to control the unmeasured factors, right, from your studies, and then evaluating how the groups differ. They continue to differ, right? But at least you might feel more confident about other factors, So here they differ in terms of, in age, they were, a little bit older, not statistically significant. In terms of gender, they are still primarily more women in the passive bilingual group, a little bit less of years of education, lower income, and primarily tested in Spanish. And so we still see these differences. But then I think going from the first slide of like bilingual, monolingual comparison now to this, how you interpret your results of evaluating whether these specific factors contribute to reserve, provide some kind of benefit of delaying age of diagnosis, maintaining cognitive functioning in the face of an AD risk factor or a brain integrity. It would be a little bit maybe more, you might think about those, how to interpret the results in a more nuanced manner and more confident than in the previous groupings. And so actually, so with that to wrap up, I'm actually, because I'm seeing there's like hand raised and Q&As, but I can't really see it. So I forgot to ask, but I'm looking forward to hopefully, active discussions afterwards. But just to conclude, so we need detailed characterization of various aspects of bilingualism, such as age of acquisition, frequency of language use, proficiency, etc. We also need the study design should carefully consider issues related to causal inferences and appropriate assessment of cognitive reserve. And bilingualism needs to be considered within the sociocultural context of the given study population. You really need to understand those factors in terms of how does it influence the models and your hypotheses. And so with that, I'd like to acknowledge obviously your funding sources and my mentors, Dr. Manley, Dr. Brickman, and everybody in our Manbrick labs, and the Offspring staff, the YCAP staff, and collaborators from the UC Davis study as well. And just here, I'd love to show the photo of Manbrick Labs from a few years ago now, and as well from the collaborators from the UC Davis study that came across from attending an advanced psychometrics methods and cognitive aging workshop, which I highly recommend for everybody to actually. Applications are open now for attending this year's methods workshop. It'll be virtual, of course. But I highly recommend it. And gracias. I guess I'll stop sharing. That's my Twitter and the lab's Twitter. So
thank you so much. That was really wonderful. We do have a couple of questions in the chat, or in the Q&A box. So I will go ahead and start some of those.
Would it be best for me to stop sharing my screen, or should I keep it up?
Either way, sometimes it's helpful for presenters to go back and reference a figure or something. So it's up to you. Either way is fine though.
All right, I'll leave it.
So the first question is, what is known about the influence of an immigrant's acculturative strategy or acculturative stress on the relationship between bilingual language proficiency and cognitive reserve?
That's a very good question. I guess to answer in brief, there's not a lot known in terms of how it relates to cognitive reserve and cognitive aging. But there is some wonderful research in terms of, for example, how it relates to the attitudes of someone wanting to become bilingual or their approach to bilingualism. And there is some research in terms of how, as you're mentioning, the stress, right? The acculturative stress, how does that then may impact a cognitive outcome in a cross-sectional sense or some other health outcome, not from a reserve or aging perspective. But exactly, I think that's a very important thing to keep in mind. For instance, in our study, in addition to the different factors that I'm evaluating through my grant, is we're also assessing their attitudes and what does it mean for them to be bilingual? Do they like it? Do they not? Do they like code switching? Because that'll matter in terms of their motivations and how they relate to that. Good question.
Awesome. I did just post in the chat from Dr. Manley the application for the advanced psychometrics workshop and cognitive aging research. So we'll also link that on the website as well. The next question is, can you speak to the potential mechanisms that you hypothesize bilingualism confers reserve or resilience. So this person is asking, even though your work is ongoing, kind of thinking down the line from an intervention perspective, do you envision kind of a long range goal of maybe making a case for learning a second language as an advantage, or training skills that bilingualism might naturally afford?
Yes, exactly. That's another very good question. I think there's like two pieces to that. One is, right, trying to understand what are the, if it provides a benefit, right, like what's the mechanisms in terms of like, what are the components, right, of bilingualism, and what is it actually doing in terms of the brain, right? So there's some of the more prominent theories are, I believe, it's like the adaptive control hypothesis, that by the ongoing back and forth of suppressing a language, activating a language, paying attention to cues to then go into the second language and using that leads to better cognitive control and may lead to some improvement in terms of either connectivity or different in integrative structures. And so that could be a potential mechanism of, if it provides a benefit, what is it doing, right? Is it strengthening? Is it allowing you to rely on other networks, as you're seeing atrophy, for example, in medial temporal structures, and you're able to rely on other structures because of the back and forth of using dual languages. So that could be, we still really need to understand what is it about that. And in terms of the intervention, yeah, ideally the goal would be, if we can understand what are the things that matter the most. Does it matter like how old you were, like how many years you've been using it, or does it not matter? Does it matter like, oh, well, you learned it at whatever life, but you're at an X degree of proficiency, and how much you're using it now? And also like in terms of your life, if is it more important to have been active, in midlife versus in late life? Ideally, if we're able to really understand all these different combinations, hopefully that can then translate to some kind of intervention.
Definitely. I think there's a lot of factors that it sounds like you guys are looking into. And related to that, we did have a question about diet factors. So if high Alzheimer's disease or dementia rates perhaps have to do with diet in different cultures, do you have any idea if that might be something related or have a correlation with your research?
I think that's there is ongoing research for that. There are studies that to try and, for example, define an association with like a Mediterranean diet, and it's associated with a lower risk of developing dementia across different cohorts. And some of that work has been done with our group with the Whitecap studies. And so diet, it is important. I think it'll be, it's obviously it's associated with one's overall health, one's socioeconomic status as well. And I think it'll be important as we continue to move these models to see how does that play a role with bilingualism as well, if at all.
Definitely. Another question related to factors that influence bilingualism. Are these factors potentially the same for trilinguals, or might there be additional factors that need to be considered for individuals who speak more than two languages?
I do think it'll be important to understand the population that we're working with, right? And what be the reasons for someone to be trilingual versus bilingual versus monolingual may differ, I think, by population, context, country that you're in. And there is some studies, interesting studies that primarily, I think these are based off of Europe. I don't remember exactly which groups that, for example, they find that more languages, being multilingual versus bilingual and monolingual, is actually provide some kind of benefit to cognitive functioning. And so that's another question worthwhile. Is it, how many languages or the type of languages, that's important to still really understand.
Yeah, I think this next question is somewhat similar, but related to within bilingual group differences as compared to bilingual to monolingual differences, as far as that's the question, but I'm thinking maybe between and with groups.
I do think that's why, in order to best try to account for these unmeasured confounds, it is best to focus within groups, right? Given that there may be a lot of things going on to why is someone bilingual versus one's monolingual, and are they appropriate groups to compare to one another? It does provide important research, but I do think as we move forward to understand what exactly about bilingualism protects, I think it's important to focus on within group and really try to understand these different moving pieces, and then how they may vary by context as well. Oh, you're muted, Julie.
Yeah. The Zoom world. The next question, and we've gotten a couple of questions about it. So, and I know you said that maybe it's difficult to say, but if you had to kind of summarize the literature, would you say becoming bilingual late in life versus early in life might affect how bilingualism would protect your cognitive status?
That's a very good question that I think we're not there yet to provide a complete, more confident answer to that. I think it'll vary, right? I think because, from my hypothesis would be like the more time you have with it and the more you can use it, that could be like the more you're exercising that might be best. But also we don't know in terms of if you're learning it late in life, just that the ability to learn it and engaging in that might be sufficient enough to provide some kind of benefit. It's unclear.
Mm-hmm. That certainly makes sense. We'll keep an eye on the literature as it progresses. Next question is related to, I think, the plot that you had with processing speed that had the big difference compared to the other
right.
spots in that figure. So this question says, any theories about the reason that processing speed was so different?
That is a good question. Not necessarily very clear, right? Because here we were expecting hopefully an impact across all these different domains. Even because that the literature largely supports that bilingualism, if it's going to provide a benefit, it's largely in these executive type tasks, given the kind of control type of hypothesis, right? And so with this measure of processing speed that's used in the toolbox, it's largely like a reaction time task, and so it's just quickly responding to different stimuli. So it's unclear if because people who are active bilinguals using both languages, there's something to that allows them to respond, process information a little bit quicker than passive bilinguals, but not really sure. That's a good question.
Yeah, that same person just said, I would have expected a working memory effect as well. But the next question relates to, let's see, a few just came in. So has cognitive reserve related to bilingualism been examined in other neurological diseases outside of Alzheimer's dementia? Or do you hypothesize that bilingualism may provide protective effects for epilepsy, Parkinson's, et cetera?
Yeah, yes, that's also a whole other thing, right? And really trying to understand, is it pathologies, disease process specific, right? And actually one of the members of your group, Annie Reyes, has done some wonderful work with bilingualism in terms of epilepsy. And so there is some literature to show that it may be either protective across different diseases. There's another group from, like I mentioned, my co-chair colleague, Subarna Aladi, and another group of people from Thomas Bach, for instance, in Scotland, that they indicate that actually there might be more of a benefit for more frontal mediated diseases, like you're thinking like FTD, versus more medial, like in Alzheimer's pathology. But I think it's still, we need to know, we still need to evaluate that a little bit more, but we do have to see that across different studies. Studies have looked at it with TBI as well. And so there's generally a consensus that it might be a benefit across diseases. Is it the same effect? Who knows? But like, as I mentioned before, we need to do, for that to be a causal inference, we have to do longitudinal design, carefully designed studies.
Yeah, definitely. Let's see. Next question is related to occupation. So is there an occupational difference that might be playing a role in the differences between active and passive bilingual participants?
Occupational difference, meaning like the type of occupations that they engage in?
I assume so, but I'm not sure from the question.
That's a wonderful question. There is some research, and then some of it done from our group as well in terms of looking at job complexity and how the different types of job and the task required may be associated with the protective effect differently by the types of jobs. So I think it'd be worth evaluating exactly how type of occupation may be associated here.
Perfect. And the question was about job complexity. I just got clarification. So perfect. We have a few other questions. So do you think that there might be generational correlations in active versus passive bilingualism that could affect level of neuroprotection?
Not sure if I understand the question by generational.
Yeah.
I guess if I'm thinking of it correctly, I do think the likelihood of somebody to be active bilingual versus passive bilingual may be driven by your generational cohort in which you're in, which I do think, some studies like even like the Pew Research data that they put out sometimes found that people who were younger in the country, Latinx, tend to be code switch more, tend to be more bilingual than older generations. And so that might be important things to keep in mind. And at least in our study, they're still the same cohort. So we wouldn't really find generational differences. But I think if we were to compare, for example, the offspring study, who are largely in midlife, compared to the YCAP study, which are in late life, is above 65, that those are different generational cohorts.
Okay. I got clarification. So first generation versus second generation immigrant status is what the participant meant by generational correlations. Is that something you all are looking at?
That's also a very good question, exactly, too, to understand. Like, for example, as I was mentioning with some of the just descriptive stuff, like the Pew Research data shows that show that later generations tend to engage in more code switching than zero or first generation immigrants. And I think it is important to document that and then to think about how that might be incorporated into these models.
Definitely. Next question is back to the more frontal mediated diseases. This person says lobar diseases, in quotes, such as AD or other dementias could have different effects of bilingualism compared to subcortical or white matter diseases such as multiple sclerosis. What are your thoughts on that?
I think that's would be a fascinating area to study, to really try to understand, like, how does that impact? Is it structure, disease specific, the benefit, if at all, or how would we vary across these different diseases? I think it's important to evaluate that. And I think another important thing to keep in mind also, we also don't know very, very well. There is some research to show, but then how do these different diseases impact bilingualism, in and of itself, like with some studies showing that bilinguals tend to lose L2 in the neurodegenerative process more so than their L1s. And so I think that's the right way to think about it, and to hopefully keep that in mind in your studies.
Definitely. Down to kind of the cellular level, this person asked about any connection between mirror neurons and passive bilinguals. So might there be any benefit from that mechanism in those individuals?
Oh, I would have to get back to you on that. I think that's a good question. I wouldn't know in terms of how to connect it in terms of a mechanistic neurobiological process, but I think that's a good question.
Yeah. Okay, let me see. We have a few more minutes. I want to make sure I didn't miss any questions. We did get a couple of questions related to research methodology, or I guess statistical methodology, if you are considering the use of structural equation modeling to evaluate contributing factors to bilingualism and dementia protection.
Yes, I think that is the more advanced statistical models that you can incorporate in terms of causal models, I think would be the best. And the structural equation model would allow for that, and as well, for instance, in terms of when we have all these different factors of bilingualism that we're evaluating with a structural SEM approach, we could evaluate how much are they each contributing to each one of these pathways or creating a factor for bilingualism. And so that is something we plan to incorporate.
Awesome. We'll be on the lookout for that, definitely. Last question, I think, for the day. How can we incorporate bilingual research into clinical practice? Specifically, are there any tips that you might have for trainees at any level of training?
In terms of incorporating into clinical practice, I think I think trying to stay up to date with literature on really understanding what we don't know, right? The limits, because I think one of the biggest things that I've seen is a lot of times people will run with like effects, like, you know, like people would expect that we'll always see a benefit on executive functioning. And so, and if a bilingual does not perform well, like let's say on a Stroop task or something, it's indicative of a deficit. And I do think we need to be much more careful about those interpretations and do our best to encourage a proper evaluation of an individual's language history in terms to understand, you know, how dominant they are in one language or the other, and how that may impact both just their performance period, you know, because we'll see like bilinguals may perform a little bit worse or provide less words, for instance, in semantic fluency tasks and letter fluencies. And so, but is that across the board, you know, across all different populations, different language histories of the individuals? It's unknown. And I think it's just important to really keep these factors in mind and then think about how you would incorporate that in terms of your interpretation, in your case conceptualization. But I think it's important to keep up with the literature for sure.
Definitely. I think that's some really great advice. Well, thank you so much. This was a wonderful session. We got lots of good comments, lots of good discussion. So everyone will look forward to seeing you next week for Understanding Pediatric Brain Injury. Thank you so much, everyone.
Thank you, everybody.